Sinusitis affects millions of people. It happens when the sinuses become inflamed. This is usually caused by a virus, bacteria, or allergens. Acute sinusitis lasts for a week or two. Recognize the symptoms and seek treatment. Early treatment prevents complications. Untreated, it can lead to serious issues. The infection can spread to the eyes or brain. Seek medical advice if you suspect sinusitis. Acute sinusitis can be classified into different types based on the cause of the inflammation. The most common types are viral, bacterial, and allergic sinusitis. Viral sinusitis is often associated with the common cold and typically resolves on its own. Bacterial sinusitis may require antibiotics for effective treatment. Allergic sinusitis is triggered by allergens such as pollen, dust mites, or pet dander. Understanding the types and causes of acute sinusitis can help you take preventive measures. While anyone can develop acute sinusitis, certain factors can increase your risk. These risk factors can include pre-existing health conditions and environmental factors. People with weakened immune systems, such as those with HIV/AIDS or undergoing chemotherapy, are more susceptible to infections, including sinusitis. Chronic conditions like asthma and allergies can also make you more prone to developing sinusitis. Environmental factors, such as exposure to secondhand smoke, can irritate the nasal passages and increase your risk of sinusitis. Additionally, living in areas with high levels of air pollution can also contribute to sinusitis. Other factors that can increase your risk include a family history of sinusitis, nasal allergies, and certain medications that suppress the immune system. By being aware of these risk factors, you can take steps to minimize your chances of developing acute sinusitis. Section 4. Diagnosing acute sinusitis. Diagnosing acute sinusitis typically involves a combination of a physical examination and a review of your medical history. Your doctor will ask about your symptoms, including the duration and severity. During the physical exam, the doctor will examine your nasal passages for signs of inflammation, such as redness, swelling, and discharge. They may also gently press on your sinuses to check for tenderness. In some cases, your doctor may recommend further tests to confirm the diagnosis or rule out other conditions. These tests can include a nasal endoscopy, which uses a thin, flexible tube with a camera to visualize the sinuses, or a CT scan to provide a more detailed image of the sinuses. Based on the diagnosis, your doctor will recommend an appropriate treatment plan tailored to your specific needs. Treatment may include over-the-counter medications to relieve symptoms, nasal sprays to reduce inflammation, or antibiotics for bacterial infections. Section 5. Prevention and precautions. While not all cases of acute sinusitis are preventable, certain measures can reduce your risk of developing this condition. One of the most effective preventive measures is practicing good hygiene. This includes washing your hands frequently with soap and water, especially after blowing your nose, coughing, or sneezing. Avoid close contact with people who are sick. Managing allergies is crucial in preventing allergic sinusitis. Identify and avoid your triggers, such as pollen, dust mites, and pet dander. Use air purifiers to reduce allergens in your home. Using a humidifier can also help prevent sinusitis by keeping the nasal passages moist. Drink plenty of fluids to stay hydrated, as this can help thin the mucus and promote drainage. If you smoke, Quitting is one of the best things you can do for your overall health, including your sinus health.